Good morning, madam.
Good morning. Today I am going to teach you how to take vital signs.
Tell me, madam, what is vitals? Why it is important?
Vital signs are basic component of assessment of physiological and psychological health of a patient. It is the sign of life.
What are the vital signs?
The vital signs are body temperature, pulse, respiration and checking blood pressure.
What are the different types of thermometer, ma'am?
Sister, there are 5 types of thermometer: clinical glass thermometer, electronic thermometer, tympanic membrane thermometer, disposable paper thermometer, temperature sensitive strips.
What are the common sites of taking body temperature?
The common sites for taking body temperature are by mouth, by axilla, by rectum and by ear.
What are the things needed?
To check vitals, we need
Thermometer put in a bottle with a saline solution, another bottle with clean water, cotton swabs, a kidney tray, a paper bag to put waste, a notepad, a pen and a watch with a second's hand.
Madam, please tell me how to take temperature by mouth.
Sister, before taking temperature, we should inform the patient that we are taking temperature. Then patient should not eat or drink 10 to 15 minutes prior.
Why we ask the patient not to drink and eat?
Because if the patient drinks any hot or cold drinks, it will vary the body temperature. So that is the reason we instruct them not to drink or eat before the taking temperature. Now I will tell you how to take temperature. First you have to take the thermometer from the solution, then wipe it nicely, then again wash it nicely in the water, plain water.
Wipe it dry with a firm twisting motion using cotton balls. Wipe once from the bulb towards the fingers with the cotton. Grasp the thermometer firmly with the thumb and forefinger. Shake the thermometer until the mercury line reaches the lowest markings. Read the thermometer by holding it horizontally at eye level and rotate in between the fingers until the mercury line can be seen clearly. Place the mercury bulb of the thermometer under the patient's tongue and instruct the patient to close the lips tightly. Leave the thermometer in place for a minimum of 3 minutes. Check the time with your wristwatch. Once the time is over, gently take out the thermometer from the patient's mouth and wipe it once from the fingers down to the mercury bulb using a twisting motion. Remember not to shake the thermometer this time and read the thermometer and take down the reading in the notepad with the patient's name and the date.
Sister, now I will teach you how to take temperature by axilla.
As I explained before, take the thermometer from the chemical solution and wipe it dry with a firm twisting motion using a cotton balls. Wipe once from the bulb towards the fingers with cotton.
Then we should know why we are checking by axilla. Because the patient is unconscious, we cannot keep the thermometer in the mouth. And for small children also we cannot check temperature by mouth. So now we will make the patient's hand like this. Now I will keep the thermometer here. The stem should be towards the patient's chest. Okay?
Leave the thermometer and place for 5 minutes or more. Once the time is over, gently take out the thermometer from the patient's axilla. Wipe it once from the fingers down to the mercury bulb using a twisting motion. Read the thermometer and take down the readings and put it back into the chemical solution and put the waste in the paper bag and take down the reading in the notepad with the patient's name and the date.
Okay, madam. I have learned about temperature. Please tell me, what is pulse?
The heart forces blood through the arteries. You feel the beats by pressing the arteries, which are located very close to the surface of the skin, and some parts of the body only we can feel the pulse.
What are the items required for taking pulse?
To check the pulse we need a watch or a stop clock and paper, pen and record it on the chart.
Madam, what are the different sites for taking pulse?
Sites for checking pulse are the either side of the neck, both sides, and in the wrist and in the elbow.
Madam, tell me the procedure for taking pulse.
The common sites for checking pulse are the lower end of the neck on both sides, then the brachial here, then the radius wrist. First use this middle finger and the index finger and press firmly and gently over the arteries.
If you cannot feel a pulse, move your fingers around the area until you locate the pulse. Begin counting the pulse when the clock's second hand is on the 12.
And check for complete 1 full minute. And if you are not able to check pulse, you can check with the other side also. While checking pulse rate, we should not use our thumb, because the pulsation in the thumb will be giving our own pulse rate. So we should not use, and we should use these 2 fingers for checking the pulse.
Madam, what is respiration? How it is measured?
Respiration rate is the number of breaths taken by a person per minute. It is always measured when the patient is at rest. And usually we measure the respiration depends upon the patient's chest movements for 1 full minute. Without informing the patient's knowledge, after counting the patient's pulse rate, we check the respiration. For adults, normally 14 to 20 breaths per minute. Sister, when we want to check respiration, keep the patient's hand like this and we can check the pulse rate, as well as we can watch for the chest movements. That way we can count the respiration rate also.
Do not inform that you are measuring respirations. Without letting go of the patient's wrist, begin to observe the patient's breathing.
What is blood pressure, ma'am?
Blood pressure is the force of blood pushing against the walls of the artery. When the heart beats, it pumps out blood into the arteries, that is 60 to 70 beats per minute.
What is normal pressure, ma'am?
The normal BP is 110/70 to 120/80 millimeter of mercury.
What are the 2 numbers in checking BP?
Blood pressure is checked in a millimeter of mercury and is given 2 numbers. For an example, 110/70. So when we write in the chart, we write it as a 110/70 millimeter of mercury.
What are the 2 readings in checking the blood pressure?
The 2 readings in checking blood pressure is systolic blood pressure and the diastolic blood pressure. The systolic blood pressure is the top number, which represents the maximum pressure in the arteries when the heart is contracting period, whereas in diastolic blood pressure is the bottom number, which represents the minimum pressure in the arteries when the heart is at resting period.
Calm the patient while taking his blood pressure. Take your time and talk to the patient.
You have to tie the cuff like this, and it should be the 2 fingers above the brachial.
Choose an armband of appropriate size for the patient. The patient has to be either lying or sitting down.
Now should feel the pulse.
The patient's arm should be extended at the heart level and well supported.
Check the stethoscope whether it's working or not. Okay, then feel the thing.
The blood pressure may be read falsely high if the arm is below the heart level.
So this is the first number 110. Okay, then the second bottom number diastolic pressure is a 70. Okay, so 110/70 heart BP. So this is the first number. Okay, this is the first number which you see. This is systolic, and diastolic where the sound disappears.
Is BP differs with the cuff?
Yes, it depends upon the patient's hand size, the cuff to be selected.
What are the abnormal pressure?
The abnormal BPs are hypertension and hypotension. In hypertension, the pressure is always above 160 millimeter of mercury. In hypotension, the pressure is below 90 millimeter of mercury.
Relax. Allow him to sit with the upper part of the body tilting forward.
எடுத்துக்கோங்க.
Give him the kidney tray. Give the gauze and clean the nose. Wear the clean gloves before you handle the patient. Sister, this is called epistaxis, where there is a bleed from the inside the nose. It is an emergency condition.
Why it is considered as emergency?
Epistaxis is usually a frightening sight for the patient and the relative, especially if a patient is a kid.
What are the causes, ma'am?
There are variety of causes for the nosebleed. Trauma to the nose, sometimes nose picking, foreign body and forceful blowing of the nose. Sometimes the tumor inside the nose or on the sigmoid region. A nasal membrane dryness which will causes also nosebleed. There is a condition called deviated nasal septum where there is a nosebleed can occur. Sometime in the cold winter, because of the changes in the climate, there is chances of nosebleed. And sometimes the medical causes which can be also cause the nosebleed. High blood pressure may cause the nosebleed. And sometimes there is a nasal septum. This is called, we say nasal septum, which is deviated. There also patient can have a nasal bleed.
How to give him a treatment, ma'am?
If there is no object inside, you have checked with your torch. If there is no object inside the nose, pinch the nose, pinch all the soft part of the nose with your index finger and thumb.
Okay.
Allow him to breathe through the mouth and hold the nose for 5 minutes and see if there is any bleed. If bleeding persists, we can give a cold pack. Apply the ice pack over the nose and the cheeks at least for 5 minutes
Okay, ma'am.
and see if there is any bleed continuously, then you have to call the ENT specialist for the pack.
Good morning, Mr. Morgan. Yeah, please can you get up for brushing your teeth? Yeah, please get up. Put your legs down and you can do by yourself. Okay, I'll give you the things for your brushing. Put your legs down properly.
Before brushing, make the patient feel comfortable. Put a small towel under his chin, not to wet his clothes or bedding. Wash your hands properly and wear clean gloves.
The patient is conscious and he can brush by himself. But since he is not able to go to the toilet, so we are making him to brush in the bed itself. Okay, first I am giving paste and brush. Sister, can you wear one pair of clean glove
Okay, ma'am.
and just help him out?
While the patient is brushing, be ready with a mug of water and a bin for patient to spit. Hold the bin at a comfortable distance for patient to spit.
See, the purpose of giving mouth care is to remove the plaques and the bacteria producing agents from the oral cavity. And the mouth care relieves the bad smell from the mouth and also it removes unpleasant taste also. So, all the food particles can be removed by brushing his teeth and he himself will feel very fresh in the morning. Even before going to the bed also, he can brush his teeth. Okay. Rinse your mouth properly, sir. Okay, are you comfortable now? Okay, you can wipe your face with this towel, sir. Yeah. Okay, sister, can you remove the gloves? Okay. Sir, are you comfortable now? Yeah. Yeah, just lie down, sir. Yeah. How are you feeling now after brushing your teeth? Feel comfortable? Good. Sister, I will teach you how to give mouth care to the unconscious patient. Now place the patient in a left lateral position, any side, because to prevent aspiration. And we should place a small towel underneath the chin to protect the patient's cloth as well as the beddings. Now keep the kidney tray to collect the waste and Listerine diluted.
Take a mouth swab and put it in the Listerine in the container. Use the tongue depressor wrapped with a clean gauze. Then take a swab dipped in Listerine to clean the mouth.
We'll make the patient to open because patient is not able to open the mouth. We'll use the.
Clean the patient's teeth, gum and sides of the mouth very gently with the Listerine soaked swab. Repeat it few times.
Okay.
Clean the mouth with a clean cloth.
Her lips are very dry, so we can apply some Vaseline over her mouth. Vaseline for the mouth, lips to prevent crack. Okay, to keep the lips moist. There is a possibility of patient can aspirate the fluid into our lungs. So to prevent that, we make the patient to one side comfortably, left lateral side. Okay. Then once the mouthwash is over, keep the patient clean and dry. Remove all the articles and keep the patient comfortable.
At the end, remove the gloves and wash your hands with the liquid soap.